It's a Northwest Lifestyle Weekend on KOMO News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Our next guest is Dr. Pearl Wren, an American Board of Physical Medicine and Rehab Subspecialty, American Academy of Pain Medicine, from the Polyclinic, Intervention Pain Management. What are we talking about here?
These are new techniques used to use injections and different medications and different biologics to inject into the area of pain to decrease the pain and enhance healing and decrease inflammation. All this new stuff that we're seeing, interventional medicine.
Very interesting. I'm anxious to hear more about this. Here is Dr. Pearl Wren with Shannon O'Kelly.
Dr. Wren, welcome. How are you doing?
I'm pretty good. How are you?
I'm doing great. Welcome to Health Talks. Excited to have you here. You're a physiatrist, physical medicine rehab physician, but our listeners need to know about your practice. I always like to get our listeners to be able to understand what you're doing in your daily life at your office as a physician. So maybe you can tell us about your practice.
Sure. So physiatry means physical medicine rehabilitation. So we're the little bit newer specialty in the medicine, like around 50 years. So we're basically treating musculoskeletal disease. So it's not belong to neurologists, not belong to orthopedic. So between nerve and bones is us.
You guys are the specialist in the musculoskeletal realm, and you deal with a lot of people, a lot of patients that have problems, and you guys are really kind of, I call it detectives of the musculoskeletal system. So you do a lot of workups and histories and physicals and a lot of diagnostics and testing to find out what's going on.
That's correct.
And in your practice, you also specialize. Do you have some kind of specialty in pain management? Did you not go to some extra training in the Academy of Pain Management?
It is true. So I'm in the specialty for pain management, especially for interventional pain management, meaning we're not only use the medications, we do a little bit procedures, injections, and that help you deeply down to the direct injury area to help you pain quicker and easier, not taking medicine every day, that type of treatment for pain management.
And you mentioned interventional pain management. Maybe you could tell our listeners that's a fairly newer term. We're hearing a lot in medicine now, this interventional pain management. Maybe you can define that for us.
Sure. So pain management, including like medications, we most time people know take meds, and other things, physical therapy, and beyond that we conjunction with interventional pain management means we use injections, a burning nerve ablations, and then we kind of a little bit aggressive or a little bit interventional. So, but it's not surgery. We use a little small probe and then needles to do the pain management. So we call interventional pain.
Right. Give us some examples of some diagnoses that you may see in your office, or maybe you frequently see in your office?
Yeah, we normally get people neck pain, back pain, and most commonly instant here, like 1 out of 10 people can get neck pain, back pain. So because your nerve get compressed with herniated disc, so we call radiculopathy, which is your nerve compressed, it causes you leg and arm pain. That pain we treated in an office use interventional like epidurals, nerve blocks, and also the facet joint pain can be arthritic pain from your spine, which is the aging process. Everybody gonna get it from the joint pain. So the nerve blocking called medial branch nerve block. Also, we can burn a nerve called nerve ablation, neurotomy, can help longer for reduce the chronic pain, like a couple years even. So it's a great procedure for that.
Good procedure. And again, there are conservative procedures in your office. And let's just touch base on this because I know a lot of patients, being a physical therapist, patients experience a lot of neck and low back pain. And you described it, either it's a compression to a nerve, or it's an impingement or irritation to a nerve, or degeneration of the facet joints. Maybe you can describe the facet joints for our listeners, because we hear that sometimes, but what are they?
That's right between the two bones with the vertebra, which is the spinal bones. So between the two bones with the disc in the middle, which is like cushions, and both sides, left and right, with the facet joint, which is you can bend and turn and twist, which that all the motion created by the joint. So with the study shows like a disc-genic pain caused from herniated disc, bulging disc, like 58%, 42% from facet joint mediated pain. So huge impact for the pain management.
We'll be back with a conversation with Dr. Pearl Wren and Shannon O'Kelly as IRG Physical and Hand Therapy's Health Talk continues after this timeout.
It's a Northwest Lifestyle Weekend on KOMO News. Now back to IRG's Health Talk.
IRG Physical and Hand Therapy's Health Talk. Our second segment now of our conversation with Dr. Pearl Wren and Shannon O'Kelly.
Dr. Wren, thank you again for taking time to come down and talk to us about your practice, and more importantly, talk about some conservative treatment that you can provide your patients for, neck and back pain, which is huge. You just said 58% of pain is from a nerve compression, and 43%, I think you said, is from a facet irritation. Tell us about these injections you're doing, because patients always ask, what are they using? What kind of steroids? How many can I have? And then, you do the injections, a guided process, so you can get right there, very specific when you inject that medication.
That's correct. We use called fluoro guided injection, spinal injection, which is mobile X-ray. We see every movement, we move the needles, and we clear knowing where we go. So epidurals, most people heard about, and then you can see that on the YouTube. Most of my patients come and say, I just saw last night, kind of, interesting. I don't know how much pain I'm going to experience. So epidural injection basically is for disc or spinal canal narrowing caused nerve pinching. And that gave you the pain in the leg and the arm, also your neck and back pain. So that injection is a steroid involved. So we use a steroid and the lidocaine, which is a numbing agent. We put that medicine right next to your nerve. So we call sometimes nerve block. So really help the inflame the nerve, which is compressed by, disc, sometimes bone spur or arthritic, ligaments. So that can give you really down the root, the direct anti-inflammatory treatment. So really fast with the guidance. So we put medicine right next to it. And the steroid is one that's high potent anti-inflammatory medicine. That's why they really help you in the localized area. It's not going to be explode the whole system like you need, and then the hip you don't need it. You don't need to get the medicine. So it's just right next to your spine and an injured area.
Tell us about the results that you see with epidural steroid injection, otherwise known as an ESI. I mean, a lot of patients will say, well, is it going to hurt? I mean, what are the outcomes? Am I going to see results after the first one? Do I have to have 2? Do I have to have 3? So maybe give our patients some understanding, because sometimes those injections are perfect. Sometimes there's a little pain after them. So there's different outcomes, right?
It is correct. Yeah, individually different. Take the pain, take the injection different way. Lots of time, anxiety, depression, and stress all impact how you take the pain. But in general, when we do injection, we do give you numbing medicine. We plenty numbing medicine. We use it.
Thank you.
And some physicians even do sedation in the past, but current study shows that the sedation could be more risk. So the physicians try to limit the risk. So we do the local anesthetic. So make sure you're really not having too much pain involved when you do shots. But injection, yes, people respond to epidurals a different way.
And the different response, I mean, sometimes they have to go back for a second one. Sometimes, I think the model is you can inject up to 3 times.
Overall, we do 3, but most time we go 1. If it worked, we don't go second one. If second one worked, we don't go third one. So,
and generally speaking, these are great results.
Yes.
Dr. Wren, thank you very much for the time, and thank you for the information.
Thank you for having me. Thanks.
Dr. Pearl Wren, along with Shannon O'Kelly. Dr. Wren, a very interesting story, got her medical degree in 1990 from the Jilin Medical College in China, and then completed an internship in internal medicine at Mercy Hospital and Medical Center in Chicago. She's at Polyclinic now, physical medicine and rehabilitation specialist. Very interesting topic, and we thank her for being with us today. We're going to come back and bring you our final thoughts as we start to wrap up the show. That's coming up right after this timeout, right here on KOMO.